Which procedure is better, dental bonding or dental veneers?
They're both great, okay, because they both restore the beauty and the cosmetically improve the smile. However, one is more conservative than the other, but one lasts longer and the other doesn't. Now let's get to the details of it. Dental bonding is usually done on a smaller surface. We can go ahead and put a full bonding on one tooth. However, the results are not going to be as good as a porcelain veneers if you're going to be covering the whole surface of the tooth. Why? Because porcelain veneers, okay, with the dental bonding, actually the dentist himself goes in and sculpts the tooth, okay, and it's a one visit procedure. With a porcelain veneer, the master ceramist, under the instruction of the cosmetic dentist, is going to fabricate that shape that they want and that color that they want, and they have more flexibility. As far as the materials go, dental bonding or dental composite, they are porous. It's just like a tooth structure. Porcelain veneers, there's no porosity on it. They're glass structure or ceramic, where it's done in the laboratory. They're more durable. Porcelain veneers are more durable restoration versus a tooth bonding. If you have a large chip, I might go with the porcelain veneers. I have to see it. Depends on how much enamel you've got. Or the dental bonding can survive depending on your bite. So the best question for that is that if I see you and I take a look at your bite, I look at the condition of your mouth, see how much enamel you've got, is there any dentin exposed, and then we will decide what's the best procedure you should do that lasts a long time and looks great.